Hi, I'm Dr. Sayana Rafacha, the Medical Director at Prime Health, and this video is all about NAD. If you're interested in trying NAD, then this video will provide you the information you need to make an informed decision. So let's dive in. What's NAD? NAD is nicotinamide adenine dinucleotide. This is a critical cofactor for all the mitochondria in our cells. It's vital to the energy production and cellular function, particularly in metabolic processes. NAD is important from detox, reducing inflammation, supporting immune function, and more. As we age, NAD levels naturally decline. So by the age of 50, our levels are approximately half of younger adults. This decline has been linked to DNA damage, inflammatory conditions, mitochondrial dysfunction, and age-related diseases. The theory is by increasing NAD levels, we can therefore enhance our ATP production, which is the energy currency for all of our cells. This in turn provides more energy to all of our cells. NAD has gained significant attention thanks to the work of Dr. David Sinclair, researcher at Harvard University. Supplementation of NAD has shown to replenish depleted levels, and in many individuals, people report improvement in symptoms after their first treatment. Research suggests that NAD supplementation can offer several potential health benefits, including reducing blood pressure and heart disease, improvement of sleep cycles through resetting the circadian rhythm, reducing brain inflammation and protect from neurodegenerative diseases, reducing the risk of cancer by promoting DNA repair, and improving skeletal muscle function and partially reversing age-related decline. Certain factors can reduce NAD levels, and that includes simply aging, viral illnesses, SSRI or antidepressant use, alcohol consumption, oxidative stress, metabolic disorders, cancer, neurodegenerative diseases, chronic inflammatory conditions like autoimmunity, UV exposure, poor diet, sedentary lifestyle, and sleep deprivation. At Prime Health, in our clinical experience, we have seen notable improvements in energy, exercise stamina, brain fog, and fatigue, especially after long COVID, and rapid improvements with a lot of patients who have experienced these symptoms. It's important to note that NAD treatment is considered experimental and is not FDA approved for any particular condition. Although animal models, clinical experience, and personal accounts suggest many benefits, rigorous research is ongoing and needed to determine specific human conditions that can be treated with NAD. While safety data is still limited, increasing NAD levels has been shown promise in reducing the growth of cancer cells. However, we have to keep in mind that we currently really don't know what increasing NAD levels will do to cancer cells. At the present time, there's no simple or affordable test that we can use to measure NAD levels reliably for the general public. Therefore, treatment results are primarily assessed based on subjective response. So please monitor how you feel after your treatment in order to gauge whether it's working or not. Now let's discuss dosing. NAD dosing can range anywhere from 100 milligrams to 1,000 milligrams in a single day. Doses of 200 milligrams or higher must be given intravenously because an intramuscular injection of that amount would be highly uncomfortable to the receiver. IV doses of 250 milligrams or above generally require at least an hour for infusion, and it can take several hours depending on your unique response. At Prime Health, we offer doses of 100 to 150 milligrams through an intramuscular injection. This procedure involves delivering NAD through a small needle to the glute or deltoid muscle, which most people tolerate very well and takes only a few seconds. To improve specific symptoms like fatigue, stamina, or brain fog, we recommend starting with 2 doses of NAD per week for several weeks to assess its impact. Higher doses tend to yield faster responses. If you don't notice any improvement after a few weeks of treatment, please consult with your medical provider to adjust the dose or consider other therapeutic options to help you reach your goals. If you experience positive effects, you can gradually decrease your frequency and dose from twice weekly to once weekly and eventually every other week, finding the optimal dose and frequency for your well-being. Common side effects of NAD treatment include lightheadedness, chest pressure, shortness of breath, a feeling of needing to sit down, headache, heaviness sensation, flushing, nausea, or diarrhea. These side effects generally subside once the infusion is either stopped or slowed down if you're getting an IV, or for intramuscular injection, the side effects typically come on within a few minutes after the injection and subside after about 10 to 15 minutes. In closing, if you want to move forward with an NAD treatment, you'll need to have a one-on-one consultation with a medical provider to address any questions and receive your prescription. We hope this video has been helpful so you can understand the risks and benefits of NAD treatment. If you're ready to proceed, please contact our office and schedule a consultation with a Prime Health provider. Thank you.